Hello friends, Dr. Harpreet here. Welcome to this channel. Today I'm going to discuss some points over the running pandemic COVID-19 coronavirus. Many myths and misconceptions are there in our community regarding it, so it is very important for us to understand what are the things which are going to benefit us and what are the things which we are unnecessarily doing and they are not going to give us any kind of a benefit. Surplus, we are just creating panic. So the number one question which has come again and again is that people are saying that whether hand dryers effective in killing coronavirus or not, because there has been myth all around that in a higher temperature coronavirus do not sustain. So no, that will not going to help you enough. Frequently washing hands or clean hands with alcohol based hand rub will going to help you. Once clean, dry them thoroughly by using paper towel or warm hand dryer. That will going to prevent you, but using only hand dryers, they will not going to kill the virus. Another question that come up is, can ultraviolet or a UV disinfectant lamps are helpful in killing the virus? No, UV lamps should not be used to sterilize the hands or other areas of the skin, as UV radiations are not that good. They are harmful for the skin and they cause skin irritation, so one must not be using that. Third question is, how effective are thermal scanners in detecting people infected with the virus? In all the airports we are using that, but how effective that is? So let me tell you, number one thing, that thermal scanners are effective in detecting fevers only. Thermal scanners cannot detect who are infected but are not yet sick with the fever. So this is because it takes 2 to 14 days. People who are infected become sick and develop fever. So this will only going to detect whether the person is having fever or not. Fourth question can be, can spraying alcohol or chlorine all over the body kill the viruses? No. Spraying such substances can be harmful to clothes or mucous membranes if it is coming in contact with eyes or mouth or any new mucous membrane. Then beware that alcohol and chlorine are used as disinfectant, so they are not good. They will work as a irritant to your skin, so don't use that. The fifth question is it safe to receive a letter or a package from China? Yes, it is definitely. It's safe to to handle or to take any product which is coming from China. That will not going to infect you. The another thing, can pets at home spread the virus? So no. At present, there is no evidence that companion animals or pets such as dogs or cats can be infected with the virus. However, it is a good idea to wash hands with soap and water after contact with pets. This protects against various common bacteria such as E. coli and Salmonella, and that can pass between pets and human. Seventh question is, do vaccines against pneumonia protect against the novel coronavirus? Again, the no is there. Vaccines against pneumonia such as pneumococcal vaccine or the Haemophilus influenza type B do not provide protection against the new coronavirus. For the coronavirus, vaccinations or any antiviral drug has not been invented yet. Can regularly rinsing your nose with saline help prevent infection with the virus? Again, no. There is no evidence that regular rinsing the nose with saline has protected people from infection with the new coronavirus. There is some limited evidence that rinsing the nose with saline can help people recover more quickly from common cold, not from the coronavirus. Eighth question can be, can gargling the mouthwash protect from infection from the virus? No, there is no evidence that using mouthwash will protect from infection from the new coronavirus. No. Another question which is commonly people are asking is, can eating garlic help prevent infections with this virus? No, garlic is healthy food that may have some antimicrobial properties. However, there is no evidence from the current outbreak that eating garlic has protected people from the new coronavirus. Another thing, the most common question again, does putting on sesame oil block the new coronavirus from entering the body? No. Sesame oil does not kill the new coronavirus. Then does the new coronavirus affect older people, or are younger people are also susceptible? People of all ages can be infected. You have to keep this thing in mind, that people of all ages can be infected, but the older people and the people with pre-existing medical conditions such as asthma, diabetes, heart disease appear to be more vulnerable to becoming severely sick with this virus. It is advised that people of all ages take proper precautions such as good hand and respiratory hygiene. Another question which is very common is, are antibiotics effective in preventing and treating virus? No, antibiotics do not work against viruses, only bacteria. So the new coronavirus is a virus, therefore antibiotics should not be used as a mean to prevention or treatment. However, if hospitalized for the 2019 coronavirus, antibiotics can be used to treat bacterial co-infections. If some infections are there cause of bacterial infestation along with the coronavirus is there, then doctors will be using the antibiotics. Are there any specific medicines to prevent or to treat the virus? No. Up to this date, there is no specific medicines recommended to prevent or treat coronavirus. So these are all the things, these are all the questions which comes to every other person's mind, and we just try to prevent yourself, be protective at your home only. Try to just focusing more on social distancing measure. You just have to be at your home. That's the only thing you can do to prevent to come the third stage of coronavirus here in India. You have to be in your home at least for 2 weeks from now on, so that we can prevent this outbreak. Thank you.